Have you ever reached for a handful of nuts at night, believing you were doing something good for your body? Never once imagining that this healthy habit could be quietly stressing your kidneys right now, without pain, without symptoms, and without a single red flag on your lab results. I'm Dr. Mark Ellis, and what worries me most is that kidney damage rarely announces itself loudly. It creeps in silently often while people are doing exactly what they think is right. Here's the urgent truth most Americans are never told. Kidney decline doesn't start with dialysis or hospital beds. It starts years earlier in small daily choices that feel harmless. You can lose a shocking amount of kidney function before blood tests ever sound the alarm, and by the time fatigue, swelling, or brain fog appear, the damage is often already advanced. That's why this matters more than almost anyone realizes, especially if you're over 50. But here's where this story changes. Because not all healthy foods affect your kidneys the same way. Some nuts can quietly protect your kidney filters, reduce inflammation, and support healthy blood flow, while others, despite their clean labels and glowing marketing, can slowly overload aging kidneys with the very minerals they struggle to clear. And the difference between those two paths often comes down to knowledge you've never been given. So stay with me until the end of this video. I'm going to show you which nuts truly support kidney health, which ones may be accelerating kidney decline without you knowing it, and how a simple change in what you snack on can influence how well your kidneys work years from now. Because when it comes to your kidneys, small choices repeated daily don't just affect your health, they shape your independence, your energy, and your future. Let's start with one of the most underestimated foods for aging kidneys: sunflower seeds. Most people see them as nothing more than a casual snack, something you grab without thinking while watching TV or tossing onto a salad. But for older adults, especially those concerned about kidney health, sunflower seeds can quietly play a protective role when used the right way. As we age, the kidneys become increasingly vulnerable to oxidative stress. This is the invisible damage caused by unstable molecules that build up from high blood pressure, blood sugar swings, medications, and simple wear and tear over decades. Inside your kidneys are millions of tiny filters called nephrons, and once those filters are damaged, they don't regenerate easily. I've seen patients who did everything right on paper, yet their kidney numbers kept drifting in the wrong direction simply because this silent damage was never addressed. This is where sunflower seeds stand out. They're naturally rich in vitamin E, a fat-soluble antioxidant that helps shield kidney cells from oxidative injury. Vitamin E works like a protective coating, keeping the outer membranes of kidney cells flexible instead of stiff and scarred. Observational studies in older adults have linked higher dietary vitamin E intake from whole foods to better estimated glomerular filtration rate, one of the key markers doctors use to assess kidney function. In simple terms, the kidneys filter more smoothly when oxidative stress is lower. Sunflower seeds also support kidney health in another critical way: circulation. Healthy kidneys depend on steady blood flow to do their job efficiently. When blood vessels narrow or stiffen, the kidneys are forced to filter under higher pressure, accelerating long-term damage. Sunflower seeds contain magnesium, a mineral that helps blood vessels relax and widen. Even modest magnesium intake has been associated with more stable blood pressure and reduced strain on kidney filtration, especially in older adults who are commonly deficient due to medications and reduced absorption. What makes sunflower seeds particularly kidney-friendly is what they don't contain in excess. Compared to many popular nuts, they are lower in phosphorus and potassium minerals that aging kidneys often struggle to clear. A small portion, about 1 tablespoon a day, provides protective nutrients without overwhelming the kidneys. More is not better here. Moderation is what turns this from a harmless snack into a supportive one. And there's one more detail most people overlook. Soaking sunflower seeds before eating helps reduce phytic acid, making them easier to digest. And reducing metabolic waste the kidneys must process afterward. Small step, big difference over time. But understanding oxidative stress is only the first layer of kidney protection, because the next factor that quietly determines kidney survival has everything to do with blood pressure and circulation. And that's where the next nut plays a very different role. If sunflower seeds help protect kidney cells from internal damage, the next question becomes even more important: how much pressure are your kidneys being forced to work under every single day? Because long before kidneys fail, They are usually being squeezed by something far more common than toxins: poor circulation and rising blood pressure. This is where pecans quietly step in. I often think about a patient I once spoke with, a man in his late 60s who did everything his doctor told him. He avoided salt, drank plenty of water, and stayed active, yet his kidney numbers continued to slide. The missing piece wasn't another medication, it was blood flow. His kidneys weren't getting the relaxed, steady circulation they needed to filter efficiently, and over time that constant pressure was wearing them down. Pecans are naturally rich in magnesium, a mineral that plays a crucial role in helping blood vessels relax. When blood vessels stay flexible instead of tight and rigid, blood moves through the kidneys more smoothly, reducing the force placed on delicate filtering units. This matters because sustained high pressure inside the kidneys slowly damages nephrons even when blood pressure readings don't look alarming on the surface. Large population studies in older adults have consistently shown that higher dietary magnesium intake is associated with better estimated glomerular filtration rate and a slower progression of chronic kidney disease. Magnesium also helps stabilize blood pressure, one of the strongest predictors of long-term kidney decline. In simple terms, when circulation improves, kidneys don't have to fight as hard to do their job. Pecans offer another advantage that often goes unnoticed: inflammation control. They contain natural polyphenols that help calm low-grade inflammation inside blood vessels and kidney tissue. Chronic inflammation acts like sandpaper inside the kidneys, gradually stiffening tissue and reducing filtration efficiency. When that inflammation eases, many people notice subtle improvements: less swelling in the legs, more stable energy, and fewer afternoon crashes. What makes pecans especially useful for aging kidneys is their mineral balance. Compared to many popular nuts, pecans are lower in phosphorus, a mineral that older kidneys struggle to clear. That means you get healthy fats and antioxidants without pushing your kidneys into mineral overload. A small handful is enough. This isn't about eating more, it's about eating smarter. But improving circulation and calming inflammation still isn't the whole story, because there's another hidden factor that determines whether kidneys age gracefully or decline faster, and it has everything to do with mineral load, not blood flow. If circulation and inflammation set the stage for kidney health, then what truly decides how long aging kidneys can keep going is something far less obvious: mineral load. This is the silent burden most people never think about, and it's exactly where macadamia nuts become one of the safest and smartest choices for older adults. I remember speaking with a woman in her early 70s who was doing everything right. She ate clean, avoided junk food, and snacked on nuts daily because she believed they were heart healthy. Yet her creatinine slowly crept upward year after year. When we looked closer, the issue wasn't sugar or salt, it was minerals. Her kidneys simply couldn't clear the constant phosphorus and potassium load anymore. Once she switched to lower mineral foods, her numbers stabilized. That's when the light bulb went on. Macadamia nuts stand out because they place remarkably little stress on aging kidneys. Compared to most nuts, macadamias are naturally very low in phosphorus and potassium, two minerals that declining kidneys struggle to remove from the bloodstream. When these minerals build up, they don't cause pain or immediate symptoms, but over time they stiffen kidney tissue, disrupt calcium balance, and quietly reduce filtration efficiency. Less mineral load means less work for tired kidneys, plain and simple. There's another reason macadamia nuts are uniquely supportive. They're rich in monounsaturated fats, especially omega-7 fatty acids like palmitoleic acid. These fats help calm chronic inflammation and keep cell membranes flexible. In the kidneys, that flexibility matters. When kidney cells become rigid and inflamed, filtration slows and creatinine begins to rise. Diets higher in monounsaturated fats have been linked to lower protein, leakage in urine, and better overall kidney outcomes, especially in older adults with blood sugar issues. Macadamia nuts also help stabilize blood sugar after meals. Sharp glucose spikes damage the tiny blood vessels that feed the kidneys, reducing oxygen delivery over time. The healthy fats in macadamias slow digestion, preventing those spikes and protecting the kidney's delicate microcirculation. This is particularly important for seniors with prediabetes or type 2 diabetes, where blood sugar swings silently accelerate kidney decline. Portion size is where macadamias shine even more. Just 5 or 6 nuts a day are enough to deliver benefits without excess calories or fat. They're best eaten mid-morning or paired with fiber-rich fruit to ease digestion and reduce metabolic waste. Stored properly, they remain stable and anti-inflammatory instead of becoming oxidized and harmful. But even the safest nuts can't protect kidneys if another hidden threat is present, because what we're about to talk about next looks harmless on the surface, yet it may be doing far more damage than most people ever imagine. After talking about mineral load and why macadamia nuts are so gentle on aging kidneys, we now need to confront something uncomfortable, because one of the most commonly eaten healthy foods in America may be doing the exact opposite, and almost no one suspects it. Let's talk about peanuts. Peanuts are deeply woven into everyday life. Peanut butter sandwiches, trail mixes, protein bars, late-night snacks. Many older adults eat peanuts daily, believing they're making a smart, affordable, protein-rich choice. But what worries kidney specialists isn't an occasional handful, it's long-term repeated exposure to risks that rarely get mentioned on labels or in wellness blogs. One of the most serious concerns with peanuts is aflatoxins. These are toxic compounds produced by certain molds that commonly grow on peanuts during farming, storage, and transportation, especially in warm and humid conditions. Aflatoxins are invisible. You can't smell them, taste them, or cook them away. Once consumed, they must be detoxified by the liver and filtered by the kidneys. In younger bodies, this process is more efficient. In older adults, detox pathways slow down, allowing these toxins to irritate kidney tissue over time. Studies have shown that chronic low-level exposure to aflatoxins is associated with oxidative stress and inflammation in kidney cells. That inflammation damages nephrons quietly, without pain, without warning signs, and without immediate changes on routine blood tests. This is why peanuts are so deceptive. The damage accumulates silently. Peanuts also place a heavy mineral burden on aging kidneys, particularly phosphorus. Healthy kidneys can clear excess phosphorus easily. Aging kidneys often cannot. When phosphorus builds up in the bloodstream, it disrupts calcium balance, pulling calcium out of bones and depositing it in soft tissues like blood vessels and kidney tissue. Over time, this calcification stiffens kidney structures and reduces filtration efficiency. Creatinine rises slowly, often dismissed as normal aging, when in reality it's ongoing strain. What makes peanuts especially dangerous is their reputation. They're marketed as heart-healthy, budget-friendly, and protein-packed. Very few people realize that frequent peanut consumption can quietly overload kidneys already working at reduced capacity. This isn't about fear, it's about awareness. For seniors focused on protecting kidney function, peanuts are far better treated as an occasional food, not a daily habit. Choosing lower toxin, lower phosphorus alternatives can significantly reduce kidney stress over time. But peanuts are not the only seed that creates problems, because the next one looks even more innocent, and it damages kidneys in a completely different and often far more painful way. After understanding how peanuts can quietly stress the kidneys through toxins and mineral overload, it's important to look at a seed that feels even more pure and wholesome to most people. Pumpkin seeds are often praised as a superfood, sprinkled on salads, blended into smoothies, added to yogurt. Yet for aging kidneys, they can create a very different kind of damage that most people never connect back to their snacks. I once spoke with an older gentleman who had never had kidney issues in his life, until seemingly out of nowhere he developed severe kidney stones. His diet looked clean. No soda, no junk food, plenty of water. The one habit he never questioned was a daily handful of pumpkin seeds, sometimes more. What he didn't realize was that his kidneys had been dealing with a slow, steady buildup long before the pain ever arrived. The main issue with pumpkin seeds is their extremely high oxalate content. Oxalates are natural plant compounds that bind with calcium in the body. In younger, healthy kidneys, oxalates are filtered out efficiently through urine. But as kidney function declines with age, that filtering process becomes less effective. Oxalates begin to accumulate, forming microscopic crystals inside the kidneys. Over time, those crystals irritate kidney tissue and can grow into kidney stones, often without warning. Research shows that diets high in oxalates are strongly associated with calcium, oxalate stone formation, especially in older adults, and those with reduced kidney filtration. Even when full stones don't form, these crystals can still scrape and inflame the delicate lining of kidney tubules. That chronic irritation leads to low-grade inflammation, stiffening kidney tissue and reducing filtration efficiency. The result is slower waste removal, rising creatinine, and fatigue that many seniors assume is just part of aging. Pumpkin seeds also contain a concentrated amount of phosphorus. As we've discussed, aging kidneys struggle to clear excess phosphorus, leading to calcium imbalance and calcification in kidney tissue. Add to that the fact that pumpkin seeds are small and easy to overeat, and it becomes very easy to overload the kidneys without realizing it. Just a few tablespoons can deliver more oxalates and minerals than aging kidneys can comfortably handle. What makes pumpkin seeds particularly misleading is how aggressively they're marketed as universally healthy. Very few labels mention oxalates or kidney strain. For people concerned about kidney stones, declining filtration, or rising creatinine, pumpkin seeds are best limited or avoided altogether. But even with oxalates and phosphorus under control, there's one final nut that causes the most confusion of all praised, everywhere consumed daily and quietly overloading aging kidneys in more ways than most people ever expect. After everything we've talked about so far, this final nut may be the most surprising and the most misunderstood of all. Almonds are everywhere. They're praised by doctors, featured in health magazines, blended into smoothies, turned into milk flour butter, and snack packs. For many Americans, almonds have become a daily habit. And that's exactly where the problem begins. I once reviewed the diet of a woman in her late 60s who was frustrated because her kidney numbers kept creeping upward despite eating clean. She had cut sugar, avoided salt, and followed every wellness trend she could find. When we looked closely, almonds showed up multiple times a day, almond milk in the morning, a handful of raw almonds in the afternoon, almond flour baked goods at night. Individually, each choice seemed harmless. Together, they created a constant overload her kidneys could no longer handle. Almonds are particularly challenging for aging kidneys because they combine three stressors at once: phosphorus, potassium, and oxalates. Phosphorus, as we've discussed, becomes harder for older kidneys to clear and contributes to calcium imbalance and tissue calcification. Potassium, while essential, places additional strain on kidneys that are already filtering more slowly. When potassium builds up, it increases the workload on kidney cells and can affect muscle and heart rhythm in vulnerable individuals. Then there are oxalates. Almonds are one of the highest oxalate-containing nuts. As kidney filtration declines, oxalates are cleared less efficiently, allowing crystals to form inside kidney tissue. These crystals don't always cause immediate pain, but they trigger inflammation, irritate kidney tubules, and reduce filtration efficiency over time. When almonds are consumed in multiple forms throughout the day, oxalate exposure quietly compounds. Nutrition research has consistently shown that high dietary phosphorus and oxalate intake are associated with faster kidney function decline in older adults, especially those with early-stage kidney disease or diabetes. What makes almonds deceptive is that their benefits are real, but they are context-dependent. What supports a younger, healthy body does not always support an aging kidney. This doesn't mean almonds are bad, it means they are not kidney neutral. For older adults focused on protecting kidney function, almonds are far better treated as an occasional food rather than a daily staple. Choosing lower mineral alternatives allows the kidneys to filter with less resistance and less inflammation. But here's the part most people never consider when these daily choices stack up over years. They don't just influence lab numbers. They can determine whether kidney decline stays slow and manageable or whether dialysis becomes part of the future. And that's the final piece we need to talk about. Before we finish, I want you to remember something important. Your kidneys have been working for you quietly every single day, filtering your blood-balancing minerals and removing waste, often without ever asking for attention. If you're watching this, it means you care about your health, and that alone puts you ahead of most people. You don't need to be perfect. You just need to be aware, consistent, and willing to make small changes that protect your body over time. If this video helped you see food, and especially everyday snacks, in a new way, do yourself a favor and save this video so you can come back to it later. Many of the most damaging habits aren't obvious in the moment, and having this information on hand can make a real difference when you're choosing what to eat day after day. And if you haven't already, subscribe to the channel and turn on notifications. Every week we share clear, science-based medical insights to help you protect your kidneys, lower creatinine naturally, and stay independent and energized as you age. Most importantly, don't lose hope. Kidney decline is not an overnight event, and neither is kidney protection. The same way small habits can slowly cause damage, small informed choices can slow that process, stabilize kidney function, and help your body work more efficiently for years to come. You still have influence over your health. And with the right knowledge, your kidneys can continue supporting the life you want to live stronger, longer, and with more confidence in the years ahead.